Have you noticed that as you've gotten older, you're waking up more often at night just to use the bathroom? Or maybe during the day, you feel like you're constantly searching for the nearest restroom, even though you just went a short while ago. For many men over 50, this becomes a daily frustration. It robs you of sleep, drains your energy, and can even make you hesitant to go out or enjoy social activities. But here's what urologists want men to know. Frequent urination is not always just part of getting older. Sometimes it's linked to common conditions like an enlarged prostate, but it can also be an early warning sign of something more serious. The good news is that with proper evaluation and care, relief is possible and your quality of life can improve dramatically. In today's video, we'll explain when to consult a urologist, what symptoms to look out for, and how early care can protect your health. Frequent urination may seem like just an annoyance, but for men over 50, it carries much more weight. At this stage of life, the body is changing, and the urinary system is often one of the first places where those changes are felt. Waking up 2, 3, or even 4 times at night is not only exhausting, but it also robs the body of deep, restorative sleep. Over time, this leads to fatigue, poor concentration, mood swings, and even a higher risk of accidents due to drowsiness. Beyond the inconvenience, frequent urination is often a sign of underlying health issues. For many men, the cause is benign prostatic hyperplasia, BPH, or prostate enlargement. This condition is extremely common after age 50 and can gradually worsen if not managed. But frequent urination can also signal diabetes, urinary tract infections, kidney disease, or even prostate cancer conditions that require early diagnosis and treatment. Urologists emphasize that men should not ignore these symptoms or assume they are simply a natural part of aging. While aging can contribute, persistent urinary frequency is the body's way of sending a warning. Acting early means easier treatment, better outcomes, and peace of mind. In short, frequent urination matters because it affects not only quality of life, but also long-term health. For men over 50, paying attention to these signs can make the difference between living with constant discomfort and regaining control and confidence. The prostate is a small gland, about the size of a walnut, but it plays an outsized role in men's urinary health. Located just below the bladder, the prostate surrounds the urethra, the narrow tube that carries urine out of the body. Because of this position, any changes in the prostate directly affect how easily a man can urinate. As men age, the prostate naturally grows. For some, this enlargement is mild and causes no symptoms. But for many men over 50, the gland becomes large enough to squeeze the urethra, slowing down or blocking the flow of urine. This condition is called benign prostatic hyperplasia, BPH. While BPH is not cancer, it can cause bothersome symptoms: frequent urination, especially at night, a weak or interrupted stream, dribbling after urination, and the feeling that the bladder never empties completely. But here's the challenge. The same urinary symptoms linked to BPH can also appear in more serious conditions. Prostatitis, or inflammation of the prostate, may cause painful urination, urgency, or burning sensations. Prostate cancer in its early stages can mimic the same signs as BPH, making it difficult to tell the difference without proper evaluation. From a urologist's perspective, this overlap is why prostate health is so critical after age 50. Men should never assume urinary frequency is just BPH or just aging. The prostate's condition must be carefully checked to rule out more serious problems. Understanding the role of the prostate helps explain why so many men over 50 experience frequent urination, and why seeing a urologist is often the key to finding both answers and relief. Not all urinary changes in men over 50 require immediate concern, but certain warning signs should never be ignored. Urologists call these red flag symptoms that point to something more serious than simple aging or mild prostate enlargement. One of the biggest red flags is waking up more than twice each night to urinate. Occasional nighttime trips are common, but when it becomes routine, it disrupts sleep and signals an underlying issue. Another warning is a weak or interrupted urine stream, which often means the prostate is pressing on the urethra. Blood in the urine is another symptom that requires urgent attention. Even a small trace of blood can be linked to infections, stones, or, in some cases, bladder or prostate cancer. Pain or burning during urination also points to infection or inflammation, while a constant feeling that the bladder never empties suggests obstruction that needs treatment. Sudden urgency or accidents where you can't reach the bathroom in time is another concern. This can mean overactive bladder, advanced BPH, or neurological conditions. Urologists emphasize that men often dismiss these signs as just getting older, but waiting too long can make treatment more complicated and limit the options available. Early evaluation helps determine whether the cause is benign prostatic hyperplasia, infection, or something more serious like cancer. The bottom line, if you experience these red flags, nighttime urination, weak flow, pain, urgency, blood, or incomplete emptying, it's time to consult a urologist. Acting early provides clarity, reassurance, and access to treatments that can improve both comfort and long-term health. When a man over 50 visits a urologist for frequent urination, the goal is not just to ease symptoms, but to uncover the real cause. The appointment typically starts with a detailed medical history, followed by a physical exam, including a digital rectal exam, DRE, to check the size and texture of the prostate. While brief and sometimes uncomfortable, this exam provides essential information. Lab tests are also key. A urine test can detect infection, blood, or sugar that may point to diabetes or kidney disease. A PSA blood test measures prostate-specific antigen levels, which help evaluate prostate cancer risk. In some cases, imaging studies like ultrasound are used to see how much urine remains in the bladder after urination or to detect stones and growths. Once the cause is identified, treatment options vary. For BPH, medications such as alpha blockers relax the muscles around the prostate, while 5-alpha reductase inhibitors shrink the gland over time. If symptoms remain severe, minimally invasive procedures like laser therapy, urolift, or even surgery may be recommended. If the issue is prostatitis, antibiotics and anti-inflammatory drugs are prescribed. For prostate cancer, treatment depends on the stage and may include active surveillance, surgery, radiation, or hormone therapy. Urologists also emphasize lifestyle modifications, cutting back on caffeine and alcohol, limiting evening fluids, exercising regularly, losing excess weight, and practicing pelvic floor exercises. These changes support medical treatments and often provide noticeable relief. The key point is that diagnosis and treatment are highly personalized. No two patients are exactly alike, and a urologist designs the plan that best fits the individual's health, goals, and quality of life. Frequent urination in men over 50 should never be dismissed as just part of aging. While it may be linked to benign conditions like prostate enlargement, it can also signal infections, diabetes, or even prostate cancer. The difference between living with frustration and regaining control often comes down to one choice: consulting a urologist. The good news is that effective treatments are available, and many men see dramatic improvement once the root cause is identified. Better sleep, stronger energy, and renewed confidence that are all within reach. But it starts with taking action. So if you've noticed weak flow, constant urges, nighttime bathroom trips, or any of the red flags we discussed, don't wait. Make an appointment with a urologist and take control of your prostate and urinary health today. If this video brought you clarity, please like, share it with others, and subscribe for more trusted health insights.